Imagine being born with a heart that is structured differently from normal. Before taking your first breath, while still developing in the womb, a part of the heart may not form correctly. Some people discover this condition shortly after birth, while others may not know they have it until later in life. This condition is called congenital heart disease, and it is one of the most common birth defects in the world. So what exactly is congenital heart disease? Congenital heart disease, often called CHD, refers to a group of heart abnormalities that are present at birth. These abnormalities affect the structure of the heart valves, or the major blood vessels connected to the heart. Because the heart develops during pregnancy, any disruption in this process can result in a congenital defect. To understand this, remember that the heart has 4 chambers, 4 valves, and a network of blood vessels that work together to circulate blood. In congenital heart disease, one or more of these structures may develop incorrectly. There are many different types of congenital heart defects. Some involve holes in the walls between the heart chambers, while others involve narrowed blood vessels or improperly formed heart valves. Some defects are mild and cause few problems, while others are severe and require immediate medical treatment. The symptoms of congenital heart disease depend on the type and severity of the defect. Some babies may develop rapid breathing, difficulty feeding, poor growth, fatigue, or a bluish color to the skin and lips due to low oxygen levels. In milder cases, symptoms may not appear until childhood or even adulthood. The exact cause of congenital heart disease is not always known. However, researchers believe that a combination of genetic and environmental factors can play a role. Certain genetic conditions, infections during pregnancy, exposure to harmful substances, or uncontrolled maternal health conditions may increase the risk. The understanding of congenital heart disease has improved greatly over the past century as doctors learned more about heart development before birth. Advances in medicine have dramatically increased survival rates and improved quality of life for people born with these conditions. Treatment depends on the type of defect. Some small defects may close on their own and require only monitoring. More serious conditions may require medications, catheter-based procedures, or open-heart surgery to correct the problem and improve blood flow. Today, artificial intelligence is helping doctors detect congenital heart disease earlier than ever before. During pregnancy, AI-assisted ultrasound systems can help identify abnormalities in the developing baby's heart. After birth, AI can analyze heart scans, echocardiograms, and patient data to support faster and more accurate diagnosis. These technologies help doctors plan treatments more effectively and improve long-term outcomes. Congenital heart disease is a condition that begins before birth and affects how the heart is formed. While some defects are mild and others are complex, modern medicine has made it possible for many people with CHD to live long and healthy lives. But even if a heart is born healthy, dangerous blockages can still develop later in life. In our next video, we'll explore blood clots explained and discover how they can suddenly block blood flow and lead to life-threatening emergencies.